Can you appreciate the presence of air in the mesenteric veins and in the bowel wall? So, what do you think the diagnosis of this case is? This is a case of mesenteric ischemia, and there are three characteristic findings of mesenteric ischemia that you can see in this CT scan. The first one is presence of gas in the bowel wall, which is called as pneumatosis intestinalis. The next one is presence of gas in the mesenteric veins, mesenteric circulation, and it is very evident, and it is a sign of late disease. And can you appreciate there is something occluding the superior mesenteric artery, the main trunk of it? Yes, this is the thrombus or embolus in this SMA, which is causing all the problems. So this is a case of mesenteric ischemia. So what happens is when the artery is occluded, bowel gets ischemic, and with ischemia, the necrosis sets in, and there is infection and necrosis that leads to anaerobic metabolism and formation of gas in the bowel wall. And when the gas in the bowel wall reaches the mesenteric veins, it means it is a sign of late disease, and the patient needs an urgent surgical exploration. And despite that, the prognosis of this patient is very poor. So the clinical clues to diagnose it early is when there is severe abdominal pain and it is out of proportion of the clinical examination findings. Okay, so this is a early clincher, and the late findings are very severe abdominal pain, guarding rigidity, abdominal distension, and patient getting in shock. Okay, and the risk factors for this disease are atrial fibrillation, atherosclerosis, elderly patients, and patient with previous cardiac disease also. And for the management part, we need immediate surgical exploration, and firstly we need to resuscitate the patient, and after resuscitation IV antibiotics, we need to immediately explore the patient, and if the revascularization is possible, do that. And we need to resect all the necrotic part of the bowel. So this is the management, and despite that, the prognosis of the patient in mesenteric ischemia is very poor. So this is all, and do follow Diagnose It for more such interesting cases and medical videos. Thank you.